Hi everyone, my name is Jennifer Lyons and I'm a VTS ECC. That stands for a Veterinary Technician Specialist in Emergency and Critical Care. I'm starting this YouTube channel to provide some fun, educational, and hopefully easy to follow videos about veterinary medicine, but with a specific focus in emergency and critical care nursing skills. I'd like to start by just telling you a little bit about myself, kind of who I am and why it is that I've decided to do this. Well, I'm 31 years old and living in Salt Lake City, Utah, although I'm initially from a small town in California called Mariposa, which is right outside of Yosemite. It's a very small rural area, the kind of town where everybody knows everybody. My path to veterinary medicine started from a really young age. I grew up with lots of cats and dogs, and I just always had a huge passion for animals, and especially for cats. I was always that girl who was telling everybody she was going to grow up to be a veterinarian. Well, when I was about 9 years old, my older sister was touring colleges, and we went to UC Davis. And I just fell in love with the school, with the atmosphere, the agricultural vibe, and I kind of just knew that that's where I wanted to go. So my mom homeschooled me until I was about 16, and then when I was 16, I started attending the local community college to get credits to be able to someday transfer to UC Davis. After a few years of attending, I was able to transfer, and I attended Davis for my bachelor's of science in animal biology with a minor in wildlife fish conservation and a master's of science in animal biology with a focus in genetics and reproduction. It was when I was getting my master's degree that I started to do research, and after a couple of years at Davis, I ended up moving to Missouri to pursue more research. It was there that I kind of realized that research wasn't the right path for me. It was a lot more computer work, Excel sheets, grant proposal writing, and a lot less actually working with the animals, which was where my real passion was. So I got my first job in veterinary medicine in Jefferson City, Missouri at a small general practice where I was a veterinary technician assistant. There, I didn't get a whole lot of experience. I started out by just cleaning kennels, doing restraint for the doctors, helping with some blood work and some prescriptions. But it really opened the door and really started me on my true journey to veterinary medicine. After doing that for a few months, I decided to move to Utah because I really missed the mountains, and I had read that Salt Lake City was having a really good job economy at the time. So I moved out here, and my first day here, I got a job as a veterinary technician at another small general practice. It was there that I really started to dip my toes more into the skills of a general practice veterinary technician. I started placing catheters, drawing blood, and helping to monitor anesthesia. So after about a year there, I decided to expand my horizons, and I applied at a nearby emergency and specialty hospital, which was a Blue Pearl. Side note here, Blue Pearl is actually owned by Mars Pet Care, which is the same Mars that makes M&Ms and candy bars. And yes, as an employee, you do get an M&Ms discount. When I applied there, they weren't actually hiring. They didn't have any job postings listed. I just emailed them and asked if they needed any help and sent my resume along. And luckily, they just so happened to need some help. And they ended up hiring me for their radiology technician position. So my job duties were going to be to help with x-rays, help with diagnostic imaging procedures such as CTs and ultrasounds. Now, when I started there, I had no idea that specialty medicine was as expansive as it was. I didn't even know there were veterinary radiologists until I was hired. So once I got hired and I started working there, my radiologist ended up going on maternity leave, and I found myself wandering into the ER and the ICU to see what was happening whenever they had a critical patient or a really busy day, and I just instantly fell in love with it, and I knew that emergency and critical care medicine was where I really wanted to be. So I transferred into that department, and I started hearing about the veterinary technician specialties, and I knew that that was what I wanted to do. And from that point on, I started researching how to become a VTS. I quickly learned that the first step is to be a licensed, credentialed, or registered technician, and so I started trying to figure out how to do that. In the state of Utah at that time, there was no credentialing program, and a lot of the credentialed technicians in Utah are actually credentialed or licensed in states nearby, like Colorado or Wyoming. Well, I started researching how to become a credentialed technician without having gone to an AVMA accredited school. The AVMA is the American Veterinary Medical Association. They're the governing body for veterinary technician schools and for veterinary schools. To apply to become a licensed, credentialed, or registered technician, you do have to pass the VTE, which is the Veterinary National Technician Exam. And to apply to take that exam, you have to have graduated from one of these accredited schools. With a couple exceptions, the state of Utah now, and at that time, in 2018 when I was applying, the state of Wisconsin. The state of Wisconsin was allowing on-the-job training applications, meaning you fulfill their hours requirements, say that you have experience in a variety of departments such as general practice, dentistry, radiology. They just want you to show that you have started to expose yourself to the typical duties of a veterinary technician. You also have to get an endorsement from a veterinarian that you've worked with. So after 2 years, the criticalist I was working with endorsed me, and I applied to become licensed through the state of Wisconsin. They did accept my application, which meant that I was now qualified to attempt to take the Veterinary Technician National Exam. Before I took it, I studied for about a year. I did a lot of the study guides, kind of just the review books, and then the practice exams. There's multiple resources out there that provide a bunch of practice questions. It's just like a practice question bank. And I did that, and I was lucky enough to pass in my first time. The test has about a 75% pass rate. And I want to take a moment here to say that my path to becoming licensed was unusual, and that I in no way am saying that you should do on-the-job training over going to an AVMA accredited school. I got lucky in that my background was extremely similar and my education was extremely similar to the education you get by going to an AVMA accredited school. However, there were still a couple of classes and a couple of courses that I didn't have or that I had lacked, such as anesthesia monitoring and surgery, that are very specific towards these veterinary technician programs. So it was definitely a lot harder for me to make sure I had all the correct knowledge going into this exam and just going into this job. I did a lot on my own of making sure that my knowledge was where it needed to be. So once I was licensed through the state of Wisconsin, I started working towards my VTS goal. Every VTS academy has different requirements. I'm just going to go over the requirements for my academy, which was 3 years of full-time work after licensure, which is about 5,760 hours. I completed this in 2.5 years because I worked more than full-time. I was working somewhere between 55 and 60 hours a week, also not recommended. The rest of the requirements are 25 hours of continuing education classes. I accomplished this by attending IBEX, but there's also plenty of local courses that you can attend if you live somewhere near an emergency specialty hospital. They'll usually host continuing education classes. You also have to fulfill your skills requirements. My academy requires 38 skills to be considered mastered by either another technician specialist or a DVM specialist. For me, those skills were things like blood transfusions, patient ventilation, anesthetic monitoring, advanced vascular access, those kinds of things. I also needed 2 letters of recommendation from either a veterinary specialist or a veterinary technician specialist. All of that consists of Part A of the application, which I did submit, but I was unfortunately declined the first time around because I hadn't met my year's requirement. So again, that was 3 years of full-time work, which accumulated to 5,760 hours. So I did have to appeal the decision of the academy with proof of my hours based on my pay stubs. A couple of months later, they did end up approving my appeal, so I was allowed to continue with my application. Now, please note, I said a couple of months later. This process is long, and throughout those months, I still had to continue with Part B of my application, so I didn't fall behind if my appeal was accepted. So throughout that time, I was working on my 50 case logs and my 4 case reports. Now for my academy, you're allowed to submit up to 75 case logs, and these have to be pretty in-depth paragraphs about your involvement in the case. So I had to go through in detail what I did and how involved I was in every single case. My case reports had to be an actual 4 to 5 page case report written detailing the case itself, why we made the decisions that we did, what happened with the patient, and then a really long discussion about the pathophysiology behind all of the decisions that were made throughout the case. After you submit all of that, that's your Part B, and I had to wait to see if my Part B was accepted for a few more months. I did get that acceptance letter, and then I worked all last summer in studying to take the exam. The exam for my academy is held at IVEX, which is the International Veterinary Emergency and Critical Care Symposium. And I studied my butt off all summer. Every vacation that we took, every weekend that I wasn't working, I was studying something, reading some kind of journal article, just doing everything I can to make sure I was as prepared as I possibly could be for this exam. But luckily for me, back in, I think it was November, I did get my acceptance saying that I passed my exam and was welcomed into the Academy of Veterinary Emergency and Critical Care Technicians and Nurses. It was while I was studying for this exam that I came up with the idea for this channel, because a lot of the material that I was using to study was human medicine material. YouTube videos about blood pressures in people, or YouTube videos about the pathophysiology of vasopressors for nurses. And while a lot of the information is very similar, it's not all exactly the same. So I saw that there was a gap in the material provided to veterinarians and veterinary technicians, and I want to be here to fill that gap. So why did I choose critical care? Well, there are 46 DVM specialties and 16 technician specialties, but I am the most intrigued by the ECC specialty because it is exciting and challenging and innovative and intense. We get to do everything. We have to know how to do everything. The emergency and critical care technician has to be familiar with the disease process for thousands of diseases. We have to be able to quickly triage a patient, get a history from an owner, perform a nursing exam, provide intensive nursing care for days on end. We also get to innovate new ways of treating patients every day. We're utilizing methods developed in human medicine and trying to figure out how to apply them to patients that range anywhere from 100-gram day-old kittens to 200-pound mastiffs. And a lot of the tools and supplies that we're using come from human medicine, like our ventilators or our MRIs. And every day is different. No day is the same. In one day, I may be administering chemotherapy or running anesthesia on a critical patient, or doing multiple venous access procedures, or doing critical care ventilation. I personally am trained to do CSF taps, bone marrow aspirates, pericardiocenteses, blood donations, blood transfusions, and place arterial catheters. Because every patient is different, this field is so challenging. The survival of many of our cases come down to the technical skills of the veterinarian and the veterinary technician that's caring for that patient. Unfortunately, this field also has an extremely high mortality rate. The patients that we see are so sick that often there's a 75 to 80% chance that they will not survive to discharge. Unfortunately, that means that the veterinarians and the veterinary technicians are required to have an extremely high degree of emotional intelligence. We have to balance our natural empathy with the constant threat of compassion fatigue. We take care of these patients for so long and so intensively that we often start to feel that they're a part of our family. And when they pass, we mourn them along the sides of their family. So I got my acceptance last year, and since then I've taken on a new position at a new specialty hospital, which is a med vet here in Salt Lake City. I love living in Salt Lake City. My husband and I are extreme outdoor enthusiasts. Whenever we're not at work, you'll find us dirt biking, mountain biking, hiking, camping, or just enjoying anything outside. So that's who I am. That's why I'm doing this. I hope you'll like this video, subscribe to my channel so that you can get notified whenever I post new content. My next video will be on the importance of the basics, which is the TPR. So how to perform a TPR and how to recognize your abnormals. So if you haven't yet, please subscribe and I'll see you next time.